So welcome everyone to the October DSM conference call. This evening we'll be talking about how sleep can boost your updated 2021 growth plan. Per usual, I will be monitoring the chat bar. Any questions are welcome and encouraged. I'll make sure to shout anything out as we go. And with no further ado, Dr. Greenman, take her away.
Well, thank you, Nicole, and please do shout out if there are any questions. I want to keep this informal, so anybody in the audience, if I go over something too quickly or you have just a general question or any kind of question, please feel free to interrupt. I intend to keep my remarks about 30 minutes or so and leave plenty of time for questions as well. So today we're going to talk about incorporating the treatment of snoring and sleep apnea into your practices, how this can be instrumental in your remainder of your 2020 growth plan and certainly beyond. The reason I want to stress how important it is for you to think about this in 2020 is that we're now we're into the last quarter of the year. Frankly, the last quarter of the year has traditionally been one of the best months for dental sleep medicine as opposed to dentistry, at least in my practice, where the last quarter can sometimes be one of the worst months because people really don't want to have dental work done too much during the holidays. However, sleep medicine is different. They want to sleep better. They want to enjoy the holidays with their families and their loved ones. Also, the medical deductions have oftentimes been met. So I can't stress enough how incorporating it or getting, if you are already treating it, getting really going on it for this last quarter, how instrumental and helpful that can be. So it was many of you already know me, know that I am a restorative dentist just like you. I do Invisalign, I do full mouth cases. This one was done many years ago in conjunction with one of my close friends, an orthodontist in my community, who completed the orthodontics. And then, as you can see, we had some restorative work to do. We're able to get this completed actually in two well-planned, actually 3 well-planned visits is what this particular case took. But again, I've gone through advanced training like you, and I am experiencing many of the same types of cases as you. I do place implants and many other services as well. I am a client of Blatchford Solutions. So if anybody on the call is not currently a member of Blatchford Solutions, I want to talk it up a little bit because as far as a coaching mentorship program, this really changed my life and changed the way I practice, and went from a practice of, where I was running around from room to room. I had contracts and a lot of employees, to one where I can work with fewer employees. I have no contractual obligation with any dental plan at all, and can see fewer patients and spend more time with them and enjoy the relationships that I can have with my patients. So I've added a lot of services since I became a member of Blatchford Solutions, and this is going back to 2002, 2003. I've been in practice now. I'm in my 40th year of practice. I'm 64 years old. I went to UCLA School of Dentistry and graduated in 1981. I have completed advanced residency type, postgraduate, or actually, they're not formal residencies. They're through private teaching institutions. The one I have attended mostly has been Aesthetic Professionals, which happens to be down the road from me, a 20-minute drive. So it's been very convenient for me. And it's run by Bruce Crispin, who was one of my faculty members, mentors as well, when I was a student at UCLA. So I have completed a comprehensive aesthetic residency, advanced fixed prosthodontics, advanced occlusion. I've attended early third molar removal training, surgical dental implantology, certainly hours and hours of that, probably a good 100 hours of training in that, both at Aesthetic Professionals, UCLA and USC. I did get my IV sedation permit back in 2008. Also, that was completed at USC. But I put it in purple here, sleep apnea, because I did complete my training in dental sleep medicine back in 2008. But of all of these, probably the biggest impact on my practice has truly been sleep apnea. Why? Well, it's added significantly to the bottom line, which I'll show you. Also, it is so enjoyable. I mean, compared to other procedures that we do that are relatively high risk. I mean, when you think about, sedating a patient, doing implants, removing third molars, any of the surgical procedures that we do, hard or soft tissue, carry with them a significant amount of risk. Sleep apnea, totally reversible, and your patients love you for it. I always tell clients of mine, and Nicole's or prospective clients, this is the one service that we can do that our patients truly thank us for, and we don't have to stick needles in them or drill holes in their heads or teeth. So it could be your purple cow. And again, this book came out some time ago, the purple cow, and how we just want to really be able to stand out from the crowd. I mean, we always talk about you can't sell better. You can sell the perception of better, and you can always sell different. So think about having a procedure that sets you apart in your community, particularly even if you're in a large market like me or in a smaller market, by incorporating dental sleep medicine, incorporating at a high level, promoting it with your patients, having your patients bring back information to their physicians, communicating with the physicians. This will get you benefit over the long run. Just in the last month, two of our clients, one in Ohio, got a call from a retiring, actually a sleep medicine specialist, a physician, who was going completely virtual in his practice. And because of that, he needed a home and help for the dental sleep medicine part of his practice. And he called our client in Ohio. And this doctor now is going to see his practice really take off even more than it has been. Another client of ours earlier today, I spoke with her. She's in the New England area in the Massachusetts. And she has been making sure that all of her patients that she's treating get her information and bring it back to their physicians. Well, a local sleep physician, another woman, has contacted her and is now referring patients. So this is something that you can do. It's going to take a little bit of effort on your and your team's part. Sleep is in the news, okay? I mean, Arianna Huffington put this book out a couple of years ago, and you can see, here's a little section from, I believe, Barnes and Noble, and how about your sleep. I can make you sleep. Here's another book, Say Goodnight to Insomnia, Sleep Smarter. And then Arianna Huffington's The Sleep Revolution. Within her book, she talks about the fundamentals of sleep, the 12 sleep fundamentals. Nicole, I'm going to try to move this bar. It's in the way of my screen. I'm not sure how to hide it, but well, we won't worry about it. But she wrote the Sleep Manifesto, and these are the 12 points of the Sleep Manifesto. A good day, here, look at number 5, for example. A good day starts with the night before. What I'm trying to tell you is that sleep is big and important to your patients, particularly when it doesn't go well. Sleep cycle is critical to maybe preventing early signs of Alzheimer's disease. And we're talking about sleep cycle troubles. We're not talking about oxygen desaturation, which is also a deadly part of sleep apnea, but just having the sleep cycle interrupted. What is one of the most common causes of a sleep cycle interruption? Unless you're a person who's having some sort of acute problem like cold, the flu, upper respiratory tract infection, obviously COVID now, or how about you've had an injury, anything that might interrupt your sleep cycle. Well, those are acute problems and they do go away. But obstructive sleep apnea, does not go away unless there's some intervention. And so that's the critical part. And so sleep cycle interruption is the crux of the problem. Even Homer Simpson got a CPAP, and I think you can see here in this picture down here on the bottom, the big snore, which was an episode of Homer wearing his CPAP, and it was pretty hilarious. But sleep is in the news, in the popular culture. I mean, even going back to the Three Stooges, they had many episodes that revolved around sleep, and of course, the three of them sleeping in the same bed, and some kind of goofy thing would happen. But again, I think we're all quite aware and know about the issues of poor sleep. Sleep apnea can recession-proof your practice, okay? And I don't think there's anything that can do it better than sleep apnea, because as long as your patients have some medical coverage, they can have treatment from you. And we, as DSM Solutions, teaches our clients and how to interface with a quality medical biller so that you can get good reimbursement for your dental sleep medicine practice, for providing oral appliance therapy and the follow-up and the like. And because medical insurance covers it, and because our clients stay out of network, then they're able to collect very nice fees through the insurance for their services, and with little to no out-of-pocket for your patients. Here's my example going back to the last significant recession, which was about 10 years ago. We all kind of, who were in practice then, certainly experienced it. But I was going along at great guns. We were having our patients essentially using their homes in Southern California as piggy banks, to pay for advanced and extensive dental procedures, veneers, what have you. And it really didn't matter what their income level was so much as if they owned a home, because the home values were just skyrocketing up until the recession hit. And then, as you can see, in my particular practice, and I'll see if I can make a little highlighter here, I began to see quite a drop-off in production collection. Well, it was in here in 2008 and then into 2009 that I began to incorporate dental sleep medicine. Well, it took a long time for me to figure out how to make this work properly, but by the tail end of 2010, I saw a significant improvement in my practice numbers. Now, what happened during that time is what I teach, and Nicole teaches our clients how to incorporate this, how to make it work. I went through a 2-year struggle trying to figure all of this out, and I want to share it with those of you that are interested in putting this together. Because as you can see, here we were still in the recession, 2011. It was just sort of the tail end of it, but look at the numbers and you can see where they are there. And I got to tell you that doctors, if you are able to keep your income up and have some money during a recession, that's a period where you can truly buy low and then ultimately be able to sell high. So again, there's big advantages to having a recession-proof dental practice. Another aspect of having a quality dental sleep medicine practice, within your practice, is that you can increase your profitability because you can basically reduce your hourly overhead. Your hourly overhead is calculated by taking a 6 to 12 month look back, subtracting your laboratory costs, and then looking at your total actual expenditures, okay, the cost of running the practice, payroll, rent, dental supplies, etc., but leave out laboratory, and divide it by the number of hours that you were seeing patients. And then you simply divide by the number of practitioners that you have. In my practice, my hourly overhead runs at over $637 per hour. Now, with 2 providers, i.e. my hygienist and I only have one hygienist who works about the same hours that I do, we would divide that hourly overhead in half, and there we go, $318.75 per hour. But if I can add another provider, okay, and not increase my overhead because the other provider is already a team member, now look what happens. Our hourly overhead would drop, again, we can divide 637.5 by 3, and now we've got, a big reduction in that hourly overhead. Now, of course, I don't see dental sleep medicine all day, so I refine it a little bit to to reflect the number of hours that we provide the service. So out of a day, we're providing that service approximately 3 hours, including the follow-up appointments, new patients, deliveries, et cetera. And so then if we adjust that, the aggregate hourly overhead then actually is $255 per hour. That means that for my part of the practice, I only have to make $255 an hour in order to break even. And, obviously we can do a lot better than that. And our hygienist now has a chance to actually, break even or maybe even become somewhat more profitable. Okay. I don't spend any more time with these OSA patients than I would with a recall. And actually it's probably less. Okay. I want to make that pretty clear. Our hourly overhead is the amount of time I spend with a patient tends to be, less than what I would with the average recall patient for the most part. So it's highly profitable, and that's what I want to get at here. An average commercial case, meaning a PPO case, our average collection on a case is about $3,500. Medicare, it will vary, but it lasts a couple of years ago, it was right around $2,000. It was just a touch under $2,000. Laboratory costs can range from $375 to $600 and more for a premium appliance. Again, remember, if you put this into your practice and you set it up properly and you spend the time to get it going in the beginning with our help, we can help you so that doctors, you do not have to spend time with these patients. An average case that comes into my practice, let's say it's a new patient, which most of them are, I will see them for an initial visit that lasts anywhere from maybe about 10 minutes, okay, and total, including meeting them, reviewing their sleep study, doing an examination, and then returning for a bite registration after the digital scan on the iTero. Again, our income during, the fourth quarter last year was from dental sleep medicine alone, it was $70,000, okay? An average, our OSA income for all of last year came to $225,000. And again, this was essentially found money, okay? We would not have had the opportunity to add this to our bottom line had I not been trained, okay? And I had no mentor to help me like I am available for my clients, and Nicole is available for the team itself. With unlimited time, and I think that is what's makes our program unique and makes us stand out. It's not just a weekend course and then you're left on your own. No, we're going to help you every step of the way, including the clinical and the medical billing. I spent over an hour today with one of our clients, the one I was talking about in Massachusetts, in New England, and we covered a couple of sleep studies that she had, what type of appliances to do. The sleep study reports that she got were rather difficult to get through. I helped her to set it all up, in her mind, made some notes so she could do her consultations. And then because I think two of these patients were Medicare, helped her again with the Medicare requirements for billing, et cetera, so that she feels comfortable moving forward, because again, she has to be the leader of her team and needs to help her team to be able to do this properly. So, the consequences of EDS, excessive daytime sleepiness, the social consequences are huge. And again, I include, motor vehicle accidents from driving drowsy, okay? Studies show that a lack of sleep, the reaction times in a driving simulator are no better than somebody who's had too much to drink. You can't think straight, called cognitive dysfunction, okay? So again, poor sleep, cognitive dysfunction. I was going to make a political joke, but I don't think I will. Poor job and school performance is part of that. And, doctors, you've been through college and you've been to dental school and you probably pulled a few all-nighters, and those were probably not your best performances on your exam. I always made sure that I was studying for days before an exam so that I could get a good night's sleep on, the night of the exam, because if they threw a curveball at me, I needed all my wits about me. And if I didn't sleep well, forget about it. Marital and family discord, erectile dysfunction is a big issue with sleep apnea in men. And just, again, lack of sleep, feeling tired, missing out on family events, etc. And there's just an issue of depression, anxiety, irritability. And if you don't get good sleep, you're just not a lot of fun to be around. I mean, face it. Medical consequences are also huge, okay? Hypertension, heart attack, stroke, congestive heart failure, cardiac dysrhythmias happen during the night, whereas you'll go through periods of you'll have tachybrady episodes. Tachycardia, meaning an abnormally increased heart rate, bradycardia, an abnormally low heart rate, with this yo-yoing of heart rate taking place throughout the night, frequently, very frequently in many cases. Well, you're supposed to go to sleep and have your body renew itself, rejuvenate itself. And so, what are the consequences of not letting your heart rest during the night? I don't think it takes a rocket science to figure that one out. Gastroesophageal reflux disorder, GERD, erectile dysfunction, I talked about it, pulmonary hypertension, and another thing called metabolic syndrome, which is also linked with diabetes, hypertension, and central body fat as well, abdominal fat. So, and this deadly stuff, it happens at night. It happens in the bed when there's no one around to help. Anybody that you ever hear about who has a cardiac event and dies in their sleep, you almost can bet that they had sleep apnea. Okay, most heart attacks happen during the day when there's some exertion going on, oftentimes in the morning, oftentimes when there's cold weather, like shoveling the snow off of the walkway. That's a prime time for heart attacks to happen. But at night, when you're sleeping and your heart rate's supposed to be down and resting, it's very rare, if you're having a normal night, to die in your sleep. Just doesn't happen. But we know of many cases where cardiac arrest has taken place during the night and there's nobody around. So what happens? These tachybrady episodes are going on. Atrial fibrillation is a common comorbid condition with obstructive sleep apnea. The heart goes into cardiac arrest. You lose consciousness and you'll never wake up. I mean, you die. And there's nobody around to help you, and nobody is aware that any of this stuff is going on. The probability of survival over an 18-year period is shown here. This is the Wisconsin cohort study. And what I want to point out is that severe apnea down here where it says AH30, which is the apnea-hypopnea index greater than 30, I think you can see that. And if you extrapolate across onto the y-axis, which is the percent survivability, you see that only about 60% of the people with severe obstructive sleep apnea are still on this earth after 18 years if they don't get it treated. I get asked about this a lot because a lot of my clients or prospective clients say, oh, I've made a few Snore guards. And they really can't make the connection sometimes about what a Snore guard versus treatment for sleep apnea. And so what I want to talk about is that a Snore guard like this is the same type of appliance for sleep apnea, okay? And they do exactly the same thing. There's no difference in the mechanism between a Snore guard and a sleep apnea appliance. And thus, if you provide a Snore guard, you are in effect providing a mandibular advancement device. They are considered durable medical equipment when provided by a dentist. And as such, they should only be provided after a diagnosis by a qualified dental practitioner. Those are the guidelines, okay? So if you're providing a snore guard and you don't have a diagnosis and you're not trained, you have potential medical legal consequences. Plus, if you're paid, okay, so forget about medical legal consequences, just from your own peace of mind and ability to sleep at night. How would you feel if you had delivered a snore guard to a patient who was a severe apneic, and then they had a cardiac event in their sleep, and they tell, let's say they die, or maybe they have a stroke, and they say, oh, I was sleeping, with Dr. Jones's snore guard. And so, how are you going to answer? Okay, doctor, did you have a diagnosis or test for sleep apnea? Well, no. Did you know that this is a durable medical equipment and you provided a medical device? Well, no. So you can see where this could possibly lead. And then just how would you feel if this happened? I mean, I forget, I don't really think about medical legal. I think about, what's right, what's wrong, and how I would feel, about certain things. So diagnosis, okay? You can't treat obstructive sleep apnea with oral appliances, or you shouldn't, we just talked about it, without a diagnosis. Two ways to get a diagnosis. Here's the the gold standard traditional way, which is within a monitored environment in a sleep lab with a technician who is monitoring and watching on a video. There's microphones and speakers so that technician can monitor snoring, and 18 to 21 channels are measured. You can see that many of them are on the head and in nasal area, and then there's these respiratory effort belts. You can see the pulse oximeter, and then here's where all of these channels are plugged into. So then that data can be transferred to the sleep technician who's in another room watching everything on a monitor. The other way to do this is with a home sleep apnea test. Home sleep apnea tests are well regarded. They are certainly within the standard of care. Sorry about that. New computer, I should make some changes there. Let me go back to where we were, and I'll get things wrapped up shortly. Home sleep apnea tests are here to stay. They're called a level 3 test. Level 3 tests do meet the standard of care, and they are diagnostic for obstructive sleep apnea. And essentially, you get a sleep study that doesn't measure as many channels. A home sleep apnea test must measure at least 4 channels. Some of them will measure more, like the one that you see here, the Aries unicorder. And the advantage of this is that maybe you don't get as much data, but you're also getting a much better night's sleep. And you can have even order 2-night tests with something like this as well. Treatment, okay, what are the treatments? And of course, there's a lot of comics. This dates back all the way to 2001, as you can see right there. And she's sewed up his head in pillows, tied him up, and now snore. The gold standard has been CPAP. I don't know that it's going to continue to be. We'll have to see. The issue with with the CPAP is compliance. Okay, less than half the people who get them are still using them after a year. Though many that do, even a large cohort of the ones who are using it wish there was some other option, but are using it because they really don't feel that they have much of a choice. And obviously that's not the most romantic thing to try to wear to bed. Oral appliances have been heavily researched beginning in the late 1990s. I was lucky to be able to do my training with one of the early pioneers in the field. His name is Glenn Clark, and was one of the early publishers of data on oral appliance therapy, some of the very first articles that came out. And over time, there's been more and more data coming out on oral appliances, and we're finding that they're proving to be not inferior to CPAP in preventing many disease modalities, etc. So, an area that you can do and feel confident that you're going to be helping your patients, helping them to live longer, feel better, and have better lives. The other part of this, doctors, is that it's easy to do this, okay? I mean, all of this is in your wheelhouse. Quality impressions, whether they're analog or digital, but that's what you need is quality impressions and a bite registration, a protruded bite registration. And this is a very simple device called the George gauge. And I think you can see here that the George gauge is measured, we're looking at a +4, so there's a protrusion of 4 millimeters from edge to edge on this particular bite registration that you see right here. DSM Solutions is a full service mentorship training program to help you to put all of the pieces together within your practice to either implement or to create a successful sleep medicine, dental sleep medicine practice. So whether you've had training or whether you've not had training as a doctor, we are the program that's for you. Our motto is just, add water and stir. And in fact, I believe that we have a web URL called addwaterandstir.com. So again, this is our motto. We want you to be successful. I got out of order here, but this is a digital impression and bite registration that we're doing in our office using an iTero element. Training is critical. Comprehensive training for doctor and team. Doctors at whatever level you're at, same with the team. We can come in, assess where you are, where you've been, and then find out what you feel you need, and then we'll also make suggestions to get you where you need to go in order to have a significant part of your practice, as part of dental sleep medicine. Now with COVID, nobody wants to travel, but even before COVID, we were training via live webinar. Sorry, everybody. Starting to get a lot of political calls coming through. So that means no travel. And we have experience for almost 10 years now in training our dentists, in their mentorship programs, in our mentorship program, without them having to travel anywhere. I'm a diplomat of the American Board of Dental Sleep Medicine. In order to achieve diplomat status, I did it the traditional track several years ago, and that meant attending in a sleep lab at least 10 hours. I spent a little more than that. I needed to have 2 sleep physicians, board certified sleep physicians, to sponsor me. I had to complete a number of prerequisite cases, and I had to submit them. I had to submit 15 cases, all of that, and then I had to complete additional classroom training in order to become eligible to sit for the 4-hour 200-question examination. So it is quite an achievement to obtain diplomat status in the American Board of Dental Sleep Medicine. Now there's an easier track, in my opinion, called the Mastery Program, which is mainly devoted to coursework. But the advantage of having this credential is with physicians, okay, and with your patients too. It certainly gives you some added credibility. Remember that a physician, in order to treat sleep, needs to have a credential. Okay, either through the Board of Internal Medicine or through the American Academy of Sleep Medicine. And to become credentialed in that field is critical for them to be qualified now to interpret sleep studies and treat sleep. I advocate for the best possible standard of care. I'm a real stickler for treating to the best possible standard of care and taking good care of people. Okay, when you take good care of people, they remember you. We get a lot of dental patients from our sleep apnea patients. So they'll come into our practice most of the time from physician referrals, but also from advertisements, our websites, etc. We help you with that part of your practice to really get it jump started. And from my relationship with those patients and my team's relationships with those patients, we simply tell them that, hey, we're a full service dental practice. We'd love to have you and your family as patients, what's going on. And we just start the conversation. And you'd be amazed how many of them we're amazed, well, not really. I mean, we kind of expected this to happen, but so many of them have become dental patients. At least 10% or more end up becoming our dental patients. And I got to tell you that toward the end of last year, one of our patients referred in his wife, and she ended up having a very extensive reconstructive procedure done, full mouth reconstruction. And what those cases, how much money those cases can bring in. So again, this is a valuable part of your practice where you can add patients to the dental practice, without really trying, let's say, and certainly without having to spend a lot of money. I'm going to help you achieve your goals, okay? And Nicole and I are available basically 24/7 with all the parts, the aspects of building a successful dental sleep medicine practice. We give you the systems, okay? You can see here that you will receive, our clients receive this comprehensive binder, which includes the documents that you need in order to do your medical billing, do your exam, et cetera, et cetera. We give you enough already printed documents to get started right away. We want you to be able to start treating patients after your initial 2-hour lecture from me and 2-hour lecture from Nicole. And then of course, you can see here that we'll get you a flash drive that'll contain the electronic format of all of these documents. You're going to need to be able to obtain sleep studies for your non-diagnosed patients. There's a myriad of ways to get that done. What works for one practice may not work for another, but we do a consultation to try to help you to have the best way to get this done. Whether you buy your own equipment, which I am a fan of because that way you have it, or you use a third party for your testing. And we'll talk about that and how to make that happen, because networking, with physicians, building this part of your practice is so critical. Medical billing seems real complicated, and it stops a lot of practitioners in their tracks. We'll help you. We'll help you connect with a highly qualified medical biller who specializes in sleep apnea, okay? Who knows how to, what the story is with the various insurance companies in most of this, in just about every state in the country. And so be able to help you to get your medical billing done so that you get maximum reimbursement, and we'll get you connected with a medical biller. No, we don't own the medical biller. We decided early on that having an interest in the medical billing is not something that we felt was anything that we wanted. We want to be an advocate for you, the doctor, and help you in any way you need. We help you to get to where you want to be. Medical insurance pays well. And I don't know if you can see, if you can look carefully, but this was earlier this year. And here is just one check that came in for one particular patient, $4,259.63. So this check came in toward the end of January. Here's another one. Again, this was okay. So this was the last summer of 2019. This one came in with a total here of payment of $6,266.34. So again, these cases do pay well. Your patients want this treatment, and many of them are more than happy to pay out of pocket as well. We'll help you to market to your existing patient base. We'll help you with your recall and talking to your recall patients. 25% of those patients have OSA. Many of them have CPAPs, but unless you ask, you're not going to know. Your dental hygienist and all your team can have a conversation with your patients. And if you just do the math, you'll find, look, if you have 25% of your patients have obstructive sleep apnea, let's say you have 8 recall patients a day. That's 2 patients every single day, 8 per week, 32 per month. Now, let's say your conversion is only 1 in 4. Okay, and I think you can do that. Only 1 in 4 agree to move forward with treatment. Well, because the average PPO insurance reimbursement is $3,500, that can add $28,000 per month to your bottom, to your gross income, minus your lab bill. And I think you can readily see how profitable this can be. And you can do it without adding to your salary overhead. We'll help you with external marketing, okay? We'll help you get your website going and looking the way it should. It needs to be geared toward CPAP alternative. And lastly, I want to put up our contact information. Nicole Greenman, she's my daughter. She has a background in marketing for sleep apnea for dentists. We started this program together in 2011 or 2012. Nicole knows more than I do.
Here's 2012.
2012. Here's her telephone number, her email. And I think what I want to do is turn it back over to her for some finishing remarks.
Yes, absolutely. Phone and email are great ways to get in touch with us. You can also reach out on the website, dentalsleepapneatraining.com, where you can book a time to have a practice consultation with Dr. Greenman and I one-on-one directly. We would love the opportunity to speak with anyone listening live or anyone listening to this recording at a later date. And again, any questions, anything that you didn't feel like asking this evening, you want to learn more about the program, myself, Dr. Greenman, don't be shy.